Hi mamas, are you wondering where to give birth and whether to choose a midwife or an obstetrician? We're going to talk about those choices in this video and more. Hi guys, I'm Haley. I'm a labor and delivery nurse, childbirth educator, certified breastfeeding counselor, doula, and mom of 3. Mamas, there are so many decisions to make once you find out that you're pregnant. One of the most important ones and necessary ones are, where are you going to give birth? There are options like the hospital, a birth center, or at home. And if you feel your heart tugging you one way or the other, the most important thing to do is research, birth centers in your local area, tour them, hospitals in your local area, tour them, and then do a lot of research on home births as well. So if you're considering, one over the other, first list what's important to you in your birth. What do you want out of your birth? Do you want a very intimate setting with no drugs and very, little to no intervention? Maybe a home birth or a birth center birth is right for you. And if you are like, I don't want any of that, give me all the drugs, then a hospital birth is probably more your route. And if you're like, you know what, I want all of those things, and then just in an environment where in case there's an emergency, then I have everything that I need, then a hospital birth could also be for you. So list everything that's important for you about your birth, tour the local centers, birth centers, and hospital, and kind of get a feel for them, and then see, what do I want? What speaks more to me? And especially, currently right now in August of 2020, we are experiencing a very different situation as far as, a birth experience in the hospital due to the coronavirus or COVID-19. And so a lot of people are choosing either, birth centers or to birth at home. And because they don't want to put themselves at risk by going to the hospital, to put their newborn baby at risk or their partner in going to the hospital, or to have to, wear a mask while they're pushing or during labor. And, there's a lot of reasons that people are choosing to have home births or birthing at the birth center. But ultimately, it's an very, very, very individual choice. I really love, let me see, Ina May, she's like the godmother of midwife or midwifery. Ina May's Guide to Childbirth. It's chock full of stories of natural childbirth where you see all kind of different situations, and it just shows you over and over again how capable you are of delivering laboring and delivering your baby, and how natural it is. And so if you are considering a home birth or a birth center birth, I highly recommend that you do read this book. And if you're choosing a hospital birth, there's nothing wrong with that either. You just need to look at all the personal pros and cons for you. And then if you are thinking about a home birth or a birth center birth, some things that you need to consider are, how close is your local hospital? Because if there is an emergency situation and you need to call 911, you want to make sure that you're very close to a hospital. Because unfortunately sometimes these things don't work out like we had hoped and like they, like in this book, like they normally, do. And there are statistics for a reason. And so you want to make sure that you have a backup plan if things don't go as planned at home or at the birth center. And you also want to make sure, if you're delivering in a birth center, that they have a doctor that they work with at the local hospital, that if you needed to transfer to the hospital, that you would have somebody there already. But now going to, as far as choosing a provider, midwife or OB-GYN. So for me, with my first 2 births, I had an OB-GYN because that's just, I didn't, really think about having anything different. But with my 3rd and my vaginal birth, my first 2 were C-sections, and then with my 3rd, which was a vaginal birth, and if you want to hear how I had a vaginal birth after 2 C-sections, then watch this video, maybe up here, I'll put it in the cards, and find out how I did that. But that being said, the difference between an OB-GYN and a midwife, okay, an OB-GYN is, they do a large spectrum of things. They're a doctor, and generally speaking, they're male or female, and for the most part, they are, they're a medical doctor, and so they're trained to be a little bit more medical, if that's a term, and more problem solving, and they usually, they're amazing doctors out there. There's the whole gamut. So it really kind of depends, because you can't kind of make blanket statements about OB-GYNs, because you have, some that will spend more time with you in the office, answering questions and stuff. And then you have others who have so many patients that they're literally in and out in 5 minutes. So there's a much larger, array of OB-GYNs. They, they perform surgeries, they perform, everything from prenatal all the way to if you have a vaginal birth or a C-section. Midwives, so there's different types of midwives. So there's a certified nurse midwives, and those are the midwives that deliver in hospitals. And then there's a lay midwife or a licensed midwife, and that's usually the midwife that would attend like a home birth or a birth center birth. That being said, some certified nurse midwives do home births as well. So you just kind of have to do your research, and the difference between those is a certified nurse midwife goes to nursing school first, and then becomes a midwife and goes to school to be a midwife. A licensed midwife or a lay midwife is someone who they still go through a course, but they don't go through nursing school first. And they're still responsible for, attending a certain amount of births and getting, the education they need on, women's health and women's reproductive health, and newborns and everything. So there's a little bit of a difference about their education. But what I've seen and witnessed in the hospitals that I've worked at and in my own births are that most midwives are more hands-on. They're more comfortable being hands-on, helping you get into different positions or recommending getting in the shower. They're a little bit more, comfortable with unmedicated deliveries or natural deliveries, or you being in different positions when you're pushing, or really thinking outside the box of like, okay, what position should we put you in order to help baby get in the best position in order for you to be able to push this baby out. So that's why with my 3rd, I went with a midwife, because I felt like, the midwife I went with, like I worked with her and seeing her come into the room and stay in the room for a long period of time in the labor and delivery room with patients, and be sitting by the bathtub while the patient's in the bathtub and talking her through a contraction and being hands-on and everything. I thought, oh my gosh, that is a beautiful thing, and that's what I want for my birth. Whereas I don't see that as much with OB-GYNs. I don't see them being as hands-on during the labor piece, or being in the room pushing with their patient as much as I do midwives. Again, like there are some really amazing OB-GYNs that will do that, but for the most part, in my experience and all of the doctors that I've worked with, it's not as common for the OB-GYNs to be more present and hands-on during your labor and birth experience as I've seen with midwives. And I think a lot of that comes from, you know, a lot of the midwives that I work with or that I have worked with, they were nurses first. And your nurse is the one, your labor and delivery nurse is the one who is in the room with you, helping you cope with those contractions, showing you things to do and your partner to do to help you, putting you in different positions, making different recommendations, and then pushing with you until, you know, the baby's head is you know, beginning to come out. And usually that's when the doctor will come in and set up and, you know, deliver the baby. So I hope this, you know, was helpful for you guys. I know I kind of stumbled through it a little bit. So if there was any lingering questions that you have that I didn't answer for you, just throw them in the comments below. Please like this video and consider subscribing if you found it helpful. And just remember, you know, whoever you go with, wherever you choose to give birth, you are amazing. You are a woman who is fully capable of giving birth, and you got this.